Nursing and midwifery rape and sexual abuse counseling. Rape and sexual abuse counseling. Definitions. 1. Sexual harassment is bullying or coercion of a sexual nature, or the unwelcome or inappropriate promise of rewards in exchange for sexual favors. In most modern legal contexts, sexual harassment is illegal. As defined by the US EOC, it is unlawful to harass a person, an applicant, or employee because of that person's sex. Harassment can include sexual harassment or unwelcome sexual advances, requests for sexual favors, and other verbal or physical harassment of a sexual nature. 2. Sexual abuse, also referred to as molestation, is forcing undesired sexual behavior by one person upon another. When that force is immediate, of short duration, or infrequent, it is called sexual assault. The offender is referred to as a sexual abuser, or often pejoratively, molester. The term also covers any behavior by any adult towards a child to stimulate either the adult or child sexually. When the victim is younger than the age of consent, it is referred to as child sexual abuse. 3. Rape is a type of sexual assault usually involving sexual intercourse or other forms of sexual penetration initiated against one or more individuals without the consent of those individuals. The act may be carried out by physical force, coercion, abuse of authority, or against a person who is incapable of valid consent, such as one who is unconscious, incapacitated, or below the legal age of consent. The term rape is sometimes used interchangeably with the term sexual assault. Nursing and midwifery rape and sexual abuse counseling. To tarnish or sully the brightness of, taint, corrupt. To damage or sully someone's good name, reputation, etc. To make unfit for ceremonial use, desecrate. To violate the chastity of someone. 5. Chastity is a state or practice of refraining from extramarital, or especially from all sexual intercourse. Every person's reaction to rape and sexual abuse will be different, and there are no rules setting out exactly how to respond when receiving a disclosure. Below are some suggestions that may enable a person to talk about their experience, how they're feeling, and to seek further help if appropriate. Remember, they have chosen to speak to you because they trust you and feel safe with you, so just be yourself. Don't try to be an expert. 6. Listen. When an individual talks of rape or abuse for the first time, they may speak in a casual manner and provide very little detail. They are exploring how it feels to talk about their experience and how others will react. To enable the person to continue with the disclosure, allow them to feel in control and talk at their own pace. Allow them to openly express their feelings. Avoid pushing for details and asking direct questions. 7. Recognize harm done. Rape or sexual abuse is possibly the most degrading act that a person can experience. Nursing and midwifery rape and sexual abuse counseling. Showing empathy and understanding or being attentive. 8. Convey belief. The person may experience disbelief and shock about what happened to them. They may also fear that others will not believe what happened. 2. Convey genuine belief. Accept what happened and the way they feel. Do not dispute what they tell you.